Great to meet everyone. My name is Dr. Therese Canaris. I'm the CEO and founder of CurieDx and a pediatric emergency physician at Johns Hopkins. So medical tests like rapid strep throat swabs are often unavailable in remote settings and developing nations. So without a test, patients are often left to just go and find antibiotics on their own. This leads to antibiotic overuse, drug-resistant bacteria, and that in turn leads to over 1 million deaths alone from drug-resistant bacteria in India. Additionally, if there are no tests, that often leads to missed infections. So with something like strep throat, that risks complications like rheumatic heart disease and rheumatic fever. So our team has created a way to predict disease like strep throat using a smartphone image and AI. Here's how it works. Patients upload an image of their throat through our mobile app. On the back end, our AI analyzes that image and offers a screening prediction. Patients and their doctors can then use that to decide on antibiotics or other next steps. Now, in developing nations worldwide, smartphone penetration rates can be anywhere from 30 to 75%. So even if there's no broadband, many people have a phone. And phones are far more available than an actual physical lab. So we're bringing lab tests to your phone. We're selling this as B2B SaaS to medical practices. And for doctors, we can improve their quality of care. We can reduce the rate of missed cases, the false negatives, for strep throat in particular, from 45% down to 5%. The value that we provide for patients is saving them hours of round-trip travel, which can be critical in low-resource settings to save on costs and lost labor. We're starting with strep throat. We have 5 other conditions coming in our pipeline, things like pink eye, rashes, urinary tract infections. So we're building these lab tests on your phone. And when we look at scaling internationally across clinics and hospitals, this becomes a $2.9 billion opportunity. For our go-to-market, we're targeting chief medical officers at telehealth practices starting in the US. For 2024, we're focused on pilots. We have 2 pilots booked, including a paid pilot, so we're generating revenue, and we're reaching them through direct sales. 2025 is for product market fit, where we expand across telehealth and urgent care practices, and we're planning to extend into India as well. For 2026 and on, we're looking at scaling primarily through electronic health record vendors for distribution partners in order to reach health and hospital systems. I'm leading this endeavor. I'm a physician MBA. I'm a serial inventor of medical devices, and I've raised over $1 million from my past projects. My co-founder, our CTO, is also an ex-founder. She's the director of engineering, and she built the Norton LifeLock identity theft app from 0 to 11 million users. So building and scaling apps is our specialty. We have AI support from our Johns Hopkins team, as well as a stellar group of advisors and mentors. For our milestones so far, we've licensed the IP from Johns Hopkins, we've submitted 2 patent applications, and our app that predicts strep throat just reached the Apple App Store last week. So actually, if you care to download it, please feel free. It's invite only. The invite code is 212121. 212121. We've booked our first 2 pilots, including first sales and other accomplishments. We've raised over $325,000 in non-dilutive. We're expecting another 1.7 million non-dilutive by the end of this year. We're actively raising 1.3 million, and of that, we have 500K in the bank. That 1.3 million helps us reach product market fit in the US for technical integrations and sales and marketing. We do have, on the regulatory front, we do have plans to launch this product as a diagnostic down the road, so we would apply to the FDA as a de novo. I'd welcome you to join us and help us transform the experience of what it's like to be sick to one of getting better faster. Thank you.